Hi, this is Dr. Curt Waller from Autism Mastery course. This is actually an overview video of my Autism Mastery course. So if we look at the current trend in autism, particularly here in the United States, the Centers for Disease Control a few years ago came out with a statistic that showed that 1 in 68 children in the US has an autism spectrum disorder. Now, others have come out more recently and feel that that number is actually higher. 1 in 45 is a recent number from the National Center for Health Statistics. So clearly there is an increasing problem. It's been increasing for many, many years, not only here in the United States, but around the world as well. So what is autism? Well, if we break it down from the classic American Psychiatric Association diagnostic criteria, it really comes down to different identifiers within 3 major categories. So social impairment problems, communication issues, what's called repetitive or stereotypical behavior, self-stimulatory behavior comes up for a lot of these kids who are on the autism spectrum. But what is often missed is the comorbid conditions. Now, the Centers for Disease Control has listed certain comorbid problems in autism. These are issues that occur in this population of individuals to a much higher degree than in other groups. And what also is seen is that many of these comorbid problems significantly contribute to different types of behavioral problems, whether it's gastrointestinal issues, whether it's immune system dysfunction, or repeated ear infections, etc. These comorbid conditions are quite prevalent. The problem is what's listed here on your screen is just a partial list. If we go back over many years of research, particularly in the area of what's called biomedical intervention, it's well known that many of the problems linked to autism is genetic, most definitely. What's called methylation problems is a very important and often overlooked problem in conventional medicine. But these kids tend to have a lot of nutritional imbalances, tremendous amount of problems with food sensitivities and digestive problems, as I just mentioned. Chronic infections in the gut is a real concern, particularly chronic Candida and what's called Clostridia bacteria. New information has emerged over the past few years with regards to environmental toxins. So things like glyphosate, inorganophosphate, pesticides are extremely problematic for this population of individuals. And certainly heavy metal toxicity as well, mercury, lead, arsenic, and others. Microglia activation, which is an immune cell in the brain, is often chronically elevated, leading to chronic neurological inflammation and then a host of neurochemical problems. And all of these things that I'm talking about, we discuss and go through in depth in the Autism Mastery course. So there are many phases of autism. There's not just one autism, there's really many different types of autism. And we can have kids who are high functioning, and we can have kids who are extremely low functioning, who have a tremendous amount of language problems, social problems, and behavioral problems. And in some cases, the self-injurious and aggressive behavior can be extremely problematic and very difficult to deal with. But there could be reasons why the self-injury behavior comes about, which is what we discuss as well in this course, particularly some of the problems related to the digestive system and the overgrowth of different types of intestinal pathogens like Clostridia. One of the things that I have recognized over the years is that in the conventional medical world, it's not that there aren't well-meaning doctors. They just haven't been trained and don't really understand many of the comorbid problems that exist with this population of individuals. So take, for example, if we took a child who does not have a diagnosis of autism, but they have a host of physical problems, chronic diarrhea, recurrent sinus and ear and respiratory infections, eczema. Maybe they've got, a bloated abdomen, a lot of gas, and they may have some anxiety and attention issues. Typically what happens with that child is at least some lab tests are done. The doctor will do some blood tests to look at the immune system, might do a stool test to see if there's some type of infection. But if that child comes in with a diagnosis of autism and has the same physical manifestations, oftentimes nothing is done. In what is often done in many of these cases is these physical problems are linked to their autism diagnosis. But if you look at the standard criteria for the diagnosis of autism coming from the American Psychiatric Association, nowhere on that list are any of these physical issues, whether it's chronic diarrhea or eczema or recurrent infections. And so what I've often recognized is that these kids tend to, there's a prejudice that occurs, and I call it prejudice by the diagnosis, meaning the diagnosis of autism to many conventional medical health practitioners, it takes away the fact that they've got these underlying physical problems, and they assume that all of these issues are just linked to their autism. So here's a case example. So this is a 4-year-old boy that comes in with a diagnosis of autism. This is a boy, by the way, that has seen his regular pediatrician, and they've kind of assumed that some of the underlying behaviors that are showing up are specifically linked or caused by his autism. So this 4-year-old boy with a diagnosis of autism, at 14 months, he began to lose eye contact, became withdrawn, and lost interest in his siblings. At about 16 months, his stools suddenly turn loose and he becomes excessively irritable. 17 months, he begins to headbang, throw himself backwards onto the floor without warning, and begins to bite his hands and have some self-injurious behavior. Other behaviors start, such as pressing his abdomen against the furniture. This could be the side of a chair, the side of a couch, or a table. Becomes excessively picky as to what he will eat and drink. And then the parents read some things online and they remove some casein and see some positive changes in eye contact within that first week, so they're encouraged. They then remove gluten as well as introduce a multivitamin, and unfortunately he doesn't get better, he actually regresses within days. So standing close to the TV set, side glancing while twisting his fingers. Increased hyperactivity, increased impulsivity are all manifestations of this new change in diet. So the parents change his diet to reduce various carbohydrates, which in a very short period of time, he starts to have improvements in his loose stools, and his abdominal bloating also decreases. So now we're on a positive upswing. But 8 weeks later, while on this new diet, he begins to have increased pressing of his abdomen on furniture as well, again. And now this time around, he starts grabbing his groin area and even pressing his groin area against furniture as well. So it's assumed that these issues are coming about because of some underlying Candida, which is a yeast problem in the gut. And so a doctor puts the child on nystatin, and his behavior becomes very goofy, giddy, silly, but he also gets very hyperactive. But unfortunately, he also starts to get fluctuating bouts of rage and increased self-injurious behavior. Not really what anybody expected. So the parents read online that they need to do some liver support and do some heavy metal detox with some type of natural remedy like chlorella and some other botanicals. And so they start these. They also introduce a probiotic for the Candida problem. And instead of getting better, the situation gets worse. The child also starts to develop facial tics and anxiety, which is significantly problematic. So what do? This is actually a very common scenario. And if you don't know some of the things to look for in the history, some of the things to look for off of lab testing, you can assume that there are certain problems that are common amongst these kids and start to implement treatment randomly. And if you don't watch out, some of these kids can get worse and sometimes much worse, which is what's happening in this particular scenario. So, integrative medicine for autism, also called biomedical intervention, is critical because of the underlying dysfunction that occurs at the physical level with these kids, much of it coming from the gut or food sensitivities or nutritional imbalances, etc. You have to have a working knowledge on how to prioritize the information. So I came up with something years ago called the 4-pillar approach. The 4-pillar approach is a foundational system that needs to be implemented, in my experience, to really take the child further with regards to development and their overall health. The first pillar is dietary intervention. The second pillar is foundational supplements. The third pillar is digestive system treatment and assessment. And then the fourth pillar is methylation. Now, there are other interventions that are implemented as well. This could be antiviral therapy, detoxification therapy, hyperbaric oxygen therapy. There's a host of other interventions, but if we don't address the 4 pillars, many of those other interventions that are tried are often not successful. So the first pillar is dietary intervention, and there's a wide variety of diets that we'll go through, from the GFCF, gluten, casein-free diet, to the specific carbohydrate, to the GAPS diet, etc. The second pillar is nutritional supplements. This is a huge area because there are many companies out there that are promoting different supplements, but not every child or not every individual with autism needs to be on every single supplement. So it's important to learn what are the highly effective foundational supplements, and what are more specialized supplements that can be implemented later, also based on lab testing, also based on behaviors. But the nutritional supplements is a significant pillar because we need to initially fill in those gaps nutritionally that are often many of these nutrients deficient in a child's diet, because many kids or individuals with autism often have a self-limited diet. The third pillar is critical, and this is knowing how to assess the digestive system for invasive Candida, Clostridia bacteria, parasites, inflammation, toxins, etc., that can adversely affect the brain and nervous system and then lead to behavioral problems. Because the invasive Candida and the Clostridia toxins that are produced can be extremely toxic, not only to the brain and nervous system, but they can also affect the energy systems in the body as well, including mitochondrial function. The fourth pillar is methylation, and we go into methylation, the methylation cycle, very in depth. We actually have 2 modules on methylation, as well as a module on folate metabolism as well. So Matthew was a child in my practice for a number of years who was a very typical child who regressed and then did extremely well with different types of biomedical intervention. So he had very typical development early on. At the age of 4 months, he received 7 vaccinations in a single day. And he went from a very good sleeper to a very poor sleeper. He'd be up throughout the night, screaming, tantruming, and then of course this led to problems where the parents also weren't sleeping. At 6 months, he contracted chickenpox, and then he got chickenpox again at the age of 3, and he was frequently sick. But what was interesting with his scenario is that he rarely developed fevers. So he seemed to meet most of his milestones from a physical standpoint, but unfortunately he was now delayed socially, poor eye contact, poor language development. The behaviors were very erratic. he would go from screaming and tantruming to being giggly, goofy, silly, etc., which is often seen with Candida overgrowth as well as bacterial overgrowth of Clostridia toxins. And then again, his language was significantly delayed. So he did a number of interventions. Methyl B12 therapy, he did extremely well. Did very well with dietary intervention, from initially gluten casein free to the specific carbohydrate diet to the low oxalate diet. Gut pathogens were always an issue for him, including Clostridia bacteria. Mitochondrial support, foundational supplement support, even low-dose naltrexone, which is an immune therapy often beneficial for autoimmune disorders, can be extremely helpful for some kids with autism in improving immune function. And did also very well with something called an ion cleanse, which is a specific detoxification device, which we'll talk about in this course as well. And so now Matthew is a recovered child from autism, doing extremely well, very social, doing very well in school. And as his mom, Terry Herning states here, what they did wasn't extraordinary. Others have done it as well. But what needs to occur is people to understand that recovery is possible, improvement is possible, and that there is hope and help out there for parents and caregivers who are struggling with, children or other loved ones with autism. So let's go briefly through the course module, some of the information and materials that's incorporated into my Autism Mastery course. So module 1, we get started with what I call the roadmap. Okay, this is understanding how to integrate the 4 pillars into practice that we talked about: diet, supplements, gut assessment, methylation. And then we spend time on identifying different comorbid conditions that can be addressed quickly and how to prioritize your intervention. Module 2, we dive headfirst into the organic acids test, specifically the organic acids test from Great Plains Laboratory. Why is it so important? Why do I feel it really needs to be a high priority test, even over other tests that might be recommended? And then what are some of the important markers on the organic acid test that need to raise some red flags for you as a parent or a healthcare practitioner of where intervention might need to be implemented or further testing might need to be done? And how to integrate the organic acid test with other types of tests as well, such as hair analysis, hair metal analysis, as well as toxic chemicals. Module 3 will take time to go through how to do a clinical intake, reviewing the health questionnaire, what information you need to obtain from a clinical intake, how to prioritize the information, and how to prioritize it in a way that makes your treatment approaches more effective. What questions you need to ask. This is a critically important part of this course. And once you become knowledgeable about what to prioritize to, what questions to ask, many times you can take a very complicated scenario and get the information you need, sometimes within 10 minutes to 15 minutes, and have a really clear idea about where you need to go. Module 4 and 5, we discuss chronic Candida and biofilm. What lab testing is best for invasive Candida, what are some of the clinical outcomes and challenges of Candida treatment as well as biofilm treatment, prescription and natural remedies for both, and how to understand and get a deeper understanding of Candida toxicity. Module 6, we get into the toxicity of Clostridia bacteria, looking at lab testing, looking at cases, looking at specific markers, understanding the biochemistry, as well as understanding the challenges and clinical outcomes that can occur with treatment. Okay, both prescription and natural remedy options, and then implementing very helpful protocols, many of which I've developed over my 20 plus years in practice. Module 7 is about diet. So we'll go through the different biomedical diets often useful for individuals with autism, troubleshooting problems, trying to pick which one is right over another. Module 8, we focus on oxalates. Oxalates can be a toxic compound in the body. What they can do is they can create crystals in the body that can get deposited in different tissues. They can lead to pain. They can lead to behavioral problems. They can even trap heavy metals in the body as well. So we'll go through that in depth. Modules 9 and 10 is where we get into the methylation cycle. Why is it so important? What can you expect from treatment? What are some different testing options? What are some different treatment options? We'll go in depth into methyl B12 injection therapy. We'll also talk about non-injection forms of B12, as well as other supplements that support the methylation cycle. Module 11 is about folate metabolism specific to what's called cerebral folate deficiency, something that is found quite often in individuals with autism, but is commonly overlooked and not tested for. Module 12, we'll get into neurochemical imbalances in autism, the role of quinolinic acid. What is it? What does it do? What are the problems? And how to treat it. We'll also get into common serotonin problems, which interestingly is often linked to deficiencies in vitamin D, which is another key component of this course, is understanding how to use vitamin D in practice. And then what are some other therapies, that are useful for these neurochemical problems? Module 13 is troubleshooting. So we can't assume that all of the struggles that an individual with autism is having behaviorally, socially, cognitively is all solely related to a biomedical issue. Many times it is, but there are scenarios where it's not. And so we need to be able to troubleshoot autism from a much more comprehensive standpoint. Anxiety, aggression, behavioral problems, constipation, sleeping issues. What else may be contributing to those issues? What are some common occurrences that you will see in practice? Module 14 will come back and assess the gut, but this time we're going to look more specifically at digestive system function, what's called comprehensive digestive stool analysis, parasite assessment, and then treatment for different types of parasites that can show up, from Giardia to Blastocystis hominis to Cryptosporidium, and talk about natural and antibiotic options for both. Module 15 is what I call bridging the gap to other testing and treatments. We'll talk more specifically about vitamin D. We'll learn more about hair analysis and how to interpret a hair analysis for heavy metals and mineral imbalances, the importance of assessing for low cholesterol, what can go wrong when lithium is low, how to test for it, why lithium supplementation can be incredibly helpful, how to use oxytocin therapy, Respin A, which is a very interesting homeopathic remedy, often extremely helpful for the language delay problems and social issues in autism. And then we'll talk about what's called PANDAS, which is an autoimmune disorder sometimes seen in autism as well. Module 16 is about how to assess for heavy metals, which testing is best for what circumstance, different types of detoxification approaches, from low-dose DMSA to different types of natural remedies, as well as discussing thyroid and adrenal problems, sometimes seen in autism as well. And then there is a ton of bonus material that is incorporated into this course as well, comparing the stool test versus the organic acid test, doing lab reviews for high oxalates, supplement rules and helpful hints, and then a host of information on environmental toxicity and autism, using the Great Plains Laboratory, what's called their GPL tox profile, interpreting results, going through case reviews, correlating information off the organic acid test that can point to problems linked to chemical toxins, and then confirming that through the GPL tox test. We even talk about some of the markers on the organic acid test that can be linked to mold toxicity and what's called mycotoxins. We get into protocols for sauna detoxification, for ion cleanse foot bath detoxification, how to use glutathione, lipoic acid, and other antioxidant supplements, the use of natural remedies like NDF and NDF plus as a means to help naturally detoxify against chemicals and heavy metals. And then again, a host of different case presentations that I have accumulated throughout the years that reinforce what you will see in practice when you start working with this population of individuals and start running these lab tests. There's a tremendous amount of course documents that we have prepared for this course as well, what we call brandable documents. These are handouts that you can take as a practitioner. You can change information around however you see fit. You can add your name to it. You can add your logo, your practice name to it, and use it as handouts already pre-made for you to hand out in your practice. We have other documents too, which are more designed for your internal use. These could be, information sheets or, articles or things like that that can also be helpful and supportive to your own practice. And those certainly could be used as handouts as well. Every module that we do, that I present, you also get the slides of the presentation in full color PDF format. So you not only get the full color format, but we also have a color, what's called a lecture note or a note-taking format. So you can print that PDF out prior to listening to the lecture, and then you can take notes if you'd like. You also get a copy of the Methyl B12, My Methyl B12 for Autism ebook as part of this course as well. Now, one thing to keep in mind is that the course is presented live, but each module lecture is recorded. So it's held within the website. For if you can't make the live event, you still have plenty of time to come back and listen to the recording. We also have pre-scheduled question and answer sessions that are built into the course as well, spaced after a certain amount of modules. And these are meant to allow for you to ask specific questions to me live. Okay, we also have breakout lectures. Many times I'll come on to a Q&A session and I'll share a new lab test that I received in my practice, and we'll go through the different labs, whether it's a hair test, whether it's an organic acid test or a GPL tox test. We'll talk about cases, and we'll do, again, lab interpretations as well. So all the Q&As are recorded, as well as the core lectures for each module are recorded for later viewing. We also have a website forum. This allows for you as an individual, whether you're a health practitioner or a parent, to have daily access to me if you choose for ongoing questions and answers. So we have the scheduled Q&A sessions, but we also have the ability of you to reach me for ongoing questions through the website forum. You also get to share and access to other course attendees' questions and insights, because people will ask me questions and I'll answer those, and then everybody can see what the responses are. There is a certificate of completion if you choose to go through the process of taking the course exams for this course. So there are exams based on this course, and that provides you the certificate of completion. And that also allows you to access the continuing education credits that are available for this course as well. So, why take this course if you are a health practitioner? Well, one of the main things is cutting out years of training. I mean, the countless hours studying and the thousands of dollars that can be acquired by traveling to conferences and seminars, trying to figure out how to best help this population of patients. So one of the things is you can get immediate help for questions through the course attendee forum. And you can do this right off your computer, whether it's in your practice or in your home. So the amount of time that you will save taking this particular course will be significant, because I'm taking my over 20 years of experience and infusing it into this course and giving it to you over a few months. You also learn how to quickly prioritize which lab tests to do first, how to organize the information from a clinical history standpoint, and come together with more effective and consistent protocols. You will learn how to troubleshoot common clinical challenges seen in practice, and again, all of that's to improve clinical outcome. And then just the abundance of practice support material, the office documents, the patient handouts, the protocols, the lecture material is tremendous. And then one of the biggest things is expanding your practice, expanding your sphere of influence to help other people in your community, because this is a community of people that really need help. There are not enough well-trained healthcare practitioners out there that know how to really in-depth treat many of the complex problems that come up with individuals on the autism spectrum. And so that's what this course is all about. It's also to help you help patients and clients by providing help, hope, and encouragement for parents themselves, because there's many of them so desperately seeking help. And it also allows you to educate patients and clients in your practice, the parents, about what are certain things they want to focus on, what are certain interventions they want to prioritize to, for them to become educated in the process as well. And the other thing is this is also is a new revenue stream for your practice. So at the same time, you're now learning a new skill that really makes a difference in this population of people. Now, this course is also open to parents and caregivers of individuals with autism, even if you are not a healthcare practitioner. I want this information to be shared. It's that important. What needs to be understood is that the course material is designed for healthcare practitioners, but it is open to everybody. So again, if you are a parent, why take the course? Well, again, just like the healthcare practitioners, you can eliminate months and potentially years of frustration trying to figure things out on your own and have access to clinically driven information that has been implemented for over 2 decades in practice, and also get immediate assistance through the forum and the Q&A sessions. And for yourself, you can also learn to prioritize which lab tests are most important and why, and what the various markers mean that help you as a parent understand what treatment interventions would take, top priority. Also, it's important for you to learn how to troubleshoot common behavioral and what's called biomedical challenges that sometimes can be seen. Okay, so you can work along with your healthcare practitioner to devise a better strategy for helping your child. This course is taught by me, Dr. Curt Waller. I have been in practice for over 20 years as an integrative and functional medicine physician. I've written a number of books on health, including a number of books for autism. I do a lot of education. I do a lot of public speaking. I speak throughout the United States, as well as internationally on biomedical intervention for autism. I'm a lab advisor for BioHealth Laboratory. I also do some clinical consults, as well as lecturing for Great Plains Laboratory. And I'm the co-founder of Integrative Medicine Academy, which is an online academy of different courses for healthcare practitioners for different types of disorders. And this particular course, the Autism Mastery course, is one of the most extensive courses that we have through Integrative Medicine Academy. But what makes this course unique is that this specific course is not only open to healthcare practitioners, but parents as well. So if you have any additional questions about the Autism Mastery course, I encourage you to reach out to us at autismmasterycourse@gmail.com. You can read more about the course at autismmasterycourse.com and get more information about new course launch dates, any new material being added to the course, etc. Thank you.